Healthcare remains a key concern for most Kenyans, with the government working to implement universal healthcare to ease the burden on citizens. One of the most expensive diseases to manage is cancer, with an estimated 48,000 Kenyans diagnosed with the ailment every year. Financial service firm ICEA has last year introduced a specialized cover to help Kenyans cope with the ailment. Reporter Brenda Kerubo spoke to ICEA General Manager George Nyakundi.
So it's almost 4 months since you launched the product. Talk to us a little bit about it.
The cancer insurance product launched by ICEA Lion Group was basically meant to cover for the financial needs of cancer patients in this country. As you may be aware, cancer is ravaging families, it's ravaging people in this country. Many people have suffered both medically and financially. And as ICEA Lion Group, we are an innovative group. As a company, we said, let's look at a product that then will cater for the financial needs of the cancer patients in this country. I need to mention that this product is not a medical product. It does not cover medical expenses per se. What it does, it provides for financial support for cancer patients, i.e. the financials that are needed to support the patients either at home, in hospital, or while traveling. As opposed to many other medical products, we provide the cash benefits to the cancer patients or their nominated beneficiaries.
So it's not a medical product, but actually a financial product.
The cancer insurance product by ICEA Lion Group caters for the entire journey of a cancer patient, right from diagnosis to palliative care. And so what the product does is the architecture provides for payouts of a certain percentage of the sum insured during diagnosis, treatment, relapse or recovery, or even when one goes into palliative care. But it also covers for surgery. In effect, what it does is at diagnosis, we pay 10% of the sum insured to the patient directly or to their nominated beneficiary. But also in terms of treatment, in terms of chemotherapy, we pay 5% of the sum insured for each course up to 5 courses every year, up to 5 courses. That means for 5 years. But also for radiotherapy, we pay 5% of the sum insured for 5 courses within 5 years. In case of surgery, the product will pay off 20% of the sum insured to the patient or to the nominated beneficiary. In terms of palliative care, some percentage is also available to cater for the upkeep of the patient in case of the patient going into palliative care. But also we realized that the cancer we are covering is the metastatic cancer, the cancer that moves from one side of the body to the other. But there are certain cancers that can be serious also, although they are not cancerous per se. We are also covering what we call benign brain tumors, which may manifest as cancers, but they're nevertheless not cancerous. So instead of diagnosis of a benign brain tumor, we pay 10% of the sum insured. But in case that tumor needs to be incised and removed through surgery, we pay 40% of the sum insured to the patient or his or her nominated beneficiary. So in effect, the product then pays, therefore, up to 150% of the sum insured in case a patient goes through the entire regime from diagnosis to treatment to palliative care, and even when there is benign brain tumor.
So why cancer? Why not another disease?
And why not cancer, by the way? HIV ravaged this country for many years, and we struggled to cope with the expenses that were associated with cancer. There are about 30,000, 40,000 deaths in this country. There are about 48,000 new diagnoses of cancer in this country. Every family in this country has been affected in one way or another by cancer, either through the expenses or the medical fees that is required to treat the cancer, but also other expenses that are not related to cancer, but nevertheless support the cancer patient. For example, if one needs to travel out of the country, you need an air ticket. If one needs to travel out of the country for treatment, you will need somebody to accompany them. Or while at home, you still need that financial support to support your family. That is why this innovative cancer product by ICEA Lion Group is truly innovative and is meant to support people suffering from cancer financially.
Right, so someone who has cancer seated at home and is watching you, or probably has a patient who has cancer, what can you say to them?
You always need to plan early. The product does not cover those that are suffering from cancer already. What it does, it enables those that think they are susceptible to cancer to save now for that time in future when they may need that financial support in case cancer sets in. It is meant for those that think that they're exposed to cancer genetically or through family relationships, etc., through family history, and they think that in future they may be diagnosed and may need treatment for cancer. Those are the ones we are targeting, not the cancer patients per se.
All right.